Hello YouTubers, it's Arya here. Welcome back to my channel. So I am still on day 3 post my nerve block. I did want to talk about the medications that they use to put me under, because this is one of the things that I was worried about, was how I was going to react to everything once I woke up. So I met with the nurse anesthetist before being put under, and we talked a little bit about, he took a little bit of a history of, I guess, my medical history, and he asked if I had depression, anxiety, and, alcohol use, drug use, marijuana use, all of that. And I told him that I did have, depression and anxiety, and no to the alcohol, no to the marijuana, because I don't smoke marijuana and or use marijuana, and you guys, sorry. And what else? Yeah, so I did tell him that, and he said he would use Versed and ketamine, and what else? I can't even think. Versed, ketamine, and oh my god, propofol. Okay, yeah. So then so he explained that he wouldn't be needing to intubate me, that it would just be kind of like a little bit of sleep, not too aware, but like not completely under, just like asleep, but not too under. Like I could still breathe on my own. So I remember they put the oxygen, and I actually don't remember falling asleep or feeling anything during the procedure, which was pretty great, because the last 2 nerve blocks before this, I only was given like Versed, and I was aware and awake and all of that. So it was nice not having to be awake because it was less stressful. And when I woke up, I feel like I woke up confused because like all of a sudden I was like sitting up on my bed and I was like, wait, what? And I was in the recovery room, and I was the last patient of the day, so nobody was around except for like nurses and staff. So that was great because, guys, I was like laughing up a storm. I was just like, I don't know, it was like the strangest thing, because before, when I went in there, I'm usually like quiet and like to be reserved and not loud or anything like that. But once I got out of there, I just remember I was just giggling and laughing out loud at like nothing. And I remember feeling so happy too. And that was like one of the weirdest things, because it was just a complete difference, And then I was like just being so talkative and like social, and I was just talking about how I was going to eat tiramisu cake, and how I love chocolate chips, and enjoying my water, and like just being so social. And that was just like, and I was just laughing to myself, and things were just funny. So I mean, it kind of was like a drunk feeling, I guess you could say. But I was just like, I don't know, it was just like having a good time, but also feeling a little bit like tired. And it was just interesting. And I remember, I think I might have mentioned this in one of my other videos, but I remember that I was telling my doctor that I felt just so happy, and then I started crying because I remember saying I've been sad for so long, and and then I went back to happy, and it was just like the most weirdest, awkwardest thing ever. And then I was just like appreciating nurses and like, oh my god, all of this stuff. So I think that's one of the things that I was worried about. Now that I think about it, it makes me want to laugh just because I can't believe the personality changes. Like when you are given all of these medications, how much you can change. I remember the very, very first time that I had a nerve block, I was completely opposite. Like I was, like once I got out of it, like everything was hurting. I couldn't get up. I was crying hysterically, is what my doctor said. And I don't even remember any of this, you guys. So this was like the opposite. So I was worried I was going to be crying again. And this was completely like the opposite, you know? I was just like, I was just like so happy and sociable and loud, and I am still embarrassed. I don't know about you guys. I must be some kind of like control freak perfectionist. Always want to be controlled, in control of my emotions. So now I feel embarrassed, but for the opposite reason. I feel embarrassed for like giggling and laughing and being loud and like not shutting up. That's one of the things that also happens is when I get nervous, I don't shut up. Yeah. So yeah, so you guys, I took a nap a little bit ago. I don't think I slept for very long, but I did take a nap, and I feel okay. I feel a little bit better. I had to take a muscle relaxer, you guys. I took Xanaflex because like, oh wait, can you guys see? Oh, well, this is starting to go away. It looks so much better, but it's like right here. Even the swelling is less today. But like I took a muscle relaxer because all of this back here, like all of this was killing me. I was like trying to stretch, and I put some CBD oil and massage it, and nothing really was helping, and my hand felt really like weak earlier and numb. Like I was trying to type to do some like assignments from my class, even though I'm on like a 1 week break, and it just felt like I was constantly battling just to get my hand to move. And then the other thing that I kind of realized too is that my voice is a little bit hoarse, which I didn't really notice until like now. Yeah. And you guys, I'm going to have my next nerve block the week after next week. Oh my gosh, my dog's going to bark. Keiko! Shh, quiet, come here. Yeah, so I'm gonna have my next nerve block the week after next, and oh, you guys, I'm kind of like, I guess I'm not too worried about it, but like, it's so weird because, you know, when you're used to being in pain like every day, and then all of a sudden you don't have pain, you feel normal again. I mean, even though the medications have made me a little bit wonky and it's kind of hard to keep my eyes open, like having no pain at all is amazing, and I don't know how long it's gonna last. And you guys, the IVs, I didn't show you guys this in my other video, but where they try to stick me, this is looking like a lot better than before, and but this is not looking better. So that's like wait, can you guys see that? That's like the this is where they ultimately put the IV because of I don't know, my veins just weren't working right, you guys. Let's see, it's kind of like a heart. Wait, can you guys see that? Yeah, you guys can see that. Wait, yeah, my veins just weren't working. I was just so dehydrated because, you know, you're not supposed to eat 8 hours before or drink water or anything, and so nothing was happening. I don't know, they just couldn't. So I am kind of worried about that because, like, what if we have the same problem? Are they going to use my wrist again? I mean, it still hurts a lot, you guys. It still hurts. But yeah, I just have to like mentally prepare for my next nerve block. But I think I'm going to try to go in there in a happy mood, because maybe that's what's going to help me be in a happy mood afterwards. Because I don't know, I just wish I was just neutral after a nerve block, but like no, I just get like all this I don't know, I just wish I was more self-contained or self-controlled. But anyways, you guys, yeah, I'm kind of nervous for my next nerve block. If I have my next nerve block, well, you know, I do plan on having it. It's going to be my 5th one. And then I meet with my doctor. I'm not sure how many nerve blocks I'm going to be getting, or, you know, if he's going to be like, you know, like after the other one, if he's going to say, okay, I'll refer you for stem cell. Like, I'm not sure what he's going to say. And now with stem cell, I would have to go to court, because workers' comp will probably, you know, refuse to even pay for anything stem cell related. So if that happens, I'd have to go to court with my lawyer and try to fight it. And if that doesn't work out, then I'd have to pay for it out of pocket. So I've been, you know, saving. I just don't know how many stem cell injections I would need. But I mean, I'd rather have the stem cell injections, because I don't want to keep, you know, going through this like injection after injection with just getting like temporary relief. I know in some cases, you know, the nerve blocks can help lessen the pain cycle, and sometimes people even go into remission. But, you know, I've had, well, it'll be 2 years in April that I've been diagnosed with complex regional pain syndrome. So I don't know. I mean, for me, I don't consider it being like in the beginning stages anymore. I feel like it's something I'm going to have to manage, and I don't want to have to manage it. Obviously, you know, I want to be cured, and I don't want to have to deal with this. So we'll see what happens, because I have a knee injury right now. If you've been like watching me, my videos, I have a knee injury, and I actually think that the ketamine, or, you know, I don't know, but my leg feels a little bit better. But it could just be my mind being, you know, out of it, because yeah. So anyways, I just, with my knee injury and my hand, like, now I have to prioritize, okay, so you know, like, what issue should I tackle first? Like with my hand and my arm, it's an issue that I've had, but should I put my injections on pause and try to focus on, you know, seeing a specialist for my knee and getting an MRI? I don't know. I just get stressed easily. Like, I feel like, oh my gosh. And then if this isn't CRPS on my leg, then obviously I need to take care of it, because I don't want to lose my leg. I don't want my leg to even develop CRPS. I've been injured for about a month now. Maybe this is like the 5th weekend actually, and putting any weight on my leg really hurts. It could just be like a torn ligament. I'm not sure, but I did call my doctor today and ask them about the referral, and they said it's processing. So they told me to call back on Monday, but it's just, I feel like it's going to be a lot. So I'm going to have to try to, you know, like, try to manage all of that. Hey guys, so I had to end the video here because YouTube now has a 15-minute limit. So I will see you guys next time. Take care, you guys. Bye.